The governor's decision to no longer pursue the Eagles Field lease follows months of contentious back and forth with the legislature, culminating in an override last week of a vetoed bill that now inserts lawmakers directly into the lease approval process.
This lease is bad. If I was sitting with the Admiral and he gave me this piece of paper to read it, first thing I would say, what part of stupid do you think I am?
Senator Jesse Lujan was one of many who questioned whether it was the military getting the better end of the deal. But Admiral Benjamin Nicholson has released a lengthy statement in response. He wrote that he has no issue with the outcome of the proceedings, but wanted to clarify the details. Nicholson says the intended lease was for a civilian hospital, not a military one, to replace the current GMH. He says even today, military personnel and their family members are sent to civilian medical facilities on average 4,000 times a year. Military health care pays for the coverage, an arrangement that happens routinely across the country. The Admiral says any new civilian hospital would be for every patient who calls this region home. He also outlined a number of specialized services that would benefit all patients. For example, a hyperbaric recompression chamber for diving injuries, specialized hemodialysis for trauma situations, and mass injury transport that could also accommodate emergency patients from the CNMI and FSM. The Admiral also addressed the $10 million payment senators had questioned. He said the Navy is mandated by federal law to receive fair market value for a lease. The original deal called for in-kind considerations, but they later agreed to a cash payment using federal ARP funds instead to address the Attorney General's concerns. Finally, he said, the Navy's commitment to net negative excess land transfers continues. More than 600 acres have been turned over, he said, and another 115 are in process. But as for Eagles Field, the Navy Secretary pledged in 2021 to help develop the land for a civilian medical complex, but since an agreement could not be reached, it will be developed to support other defense mission requirements. Nestor Lecanto, KUAM News.